Or at least the most entertaining, right? Okay. So.
Do you have any cool tricks?
That's okay. My work group was charged with enhancing and expanding services at the Platte City and the Junction City C-Box. And our specific charge was to open the clinic 5 days a week at Platte City and to enhance the services provided there. Similarly with Junction City, they're already open, have a full teams going, but enhancing the services they already have. So we had a very large group that worked on this over a period of a couple weeks. We had representatives from virtual care, nursing, medicine, public affairs, human resources, respiratory care, pharmacy, nutrition, social work, business office, and behavioral health. So we had quite a group. And I was thankful for the group. We really worked well together, and I think we came up with a nice plan for the future of these two C-Box. The first thing we did was look at the number of consults for outsourcing care or having interior care inside our VA and from individuals in the Platte City C-Box area. We started with them first. And the greatest number of consults were for mental health individual appointments, audiology, clinical pharmacy, CPAP, dermatology, social work, and then general respiratory therapy and spirometry, nutrition, and diabetic retinal screen. So that gave us a good start on to know what we should offer at the C-Box as far as services. Also, executive leadership requested that we look at having chiropractic services available at the Platte City C-Box. We did look at that. We looked at the number of consults for chiropractic care for veterans in that service area, as well as consults around in the Leavenworth area, and Wyandotte service area, and the St. Joseph area. So the recommendation from the group for this was to have a shared chiropractor between the Leavenworth campus and the Platte City C-Box to go back and forth, and then veterans from all through our service areas on this side of our campuses would be able to access the chiropractor. So for the Platte City C-Box, we would recommend offering a variety of different services in a couple different formats, either face-to-face services or via telehealth. And you all know how much I love telehealth. We must do more. So anyway, it's a combination of both. The first thing is to expand our primary care team face-to-face to full-time, 5 days a week, and that is scheduled to happen on September 18th. So, yay! We have a new nurse practitioner coming on, and our existing staff at the C-Box will transition to being full-time at that C-Box. Secondly, we'll have prospectively a physician-led team at the Platte City C-Box, a second team, and that's coming along in the future. Again, they would need a full supporting team to support them. So we will be moving towards that in the model also. As far as the adjunct services provided at the C-Box, the recommendation is to provide, of course, continuing telederm by telehealth, offering telepsychiatry, recommending a full-time telepsychiatrist for that position, and perhaps that would offer more telepsychiatry throughout our campuses. Social work, being able to offer that face-to-face with the social worker that comes there now 1 day a week, increasing to 5 days a week as the clinic grows. We recommended offering caregiver support groups via telehealth, also nutrition, speech pathology, respiratory therapy, and they could offer CPAP follow-up, COPD education, and home oxygen certification. Wouldn't that be cool to offer that via telehealth rather than having a patient track all the way over here in a very large building? They could go close to their home and get their oxygen certification done there. We talked about the chiropractor being face-to-face. Teleretinal is a consideration, as well as audiology, nephrology, infectious disease, and oncology. So It's a wide menu of services and a variety of formats that we could offer. We do have the room there for these services. We have a little bit more equipment to buy. And, again, the recruitment for the staffing to support the second team. There's an advertising budget for this, and, Mr. Burks is in charge of that, so we're looking forward to hearing more about our expanded services at that CBOC. For the Junction City CBOC, same thing. We went through and analyzed the consults for the veterans living in the zip codes surrounding the CBOC. Very similar profile of what's in demand. So we took a look at our existing structure. We already do have 3 teams functioning. So it's the adjunct services that support them that we needed to enhance. The conclusion was, based on our consults, that we recommended that to enhance telehealth services at the CBOC, increase our telederm, teleretinal services, increase our existing telepsychiatry services, provide the caregiver support through telehealth, nutrition, speech pathology, pharmacy, biofeedback, and again, nephrology, infectious disease, and oncology. Audiology is going to be face-to-face out there. They're actually getting an audiology booth, so that will be wonderful. And also we have face-to-face social work services out there. We have plenty of, we have the equipment and staffing out there. Basically, we just need to do it to, to move forward utilizing telehealth and optimizing the services provided at the CBOC. That's all I have. Are there any questions?